using Botox to prevent sweat from forming under their arms during debutante balls. Never heard of this before. Would you like your daughter, or would you let your daughter use a little Botox? 96900 693. Dr Grace Lin is a cosmetic physician from Kiora Medical Spas. So welcome to the show.
Hello Dennis, how are you?
Yeah, I'm fine. Is it true schoolgirls using Botox specifically to stop perspiration?
Yes, it does. We have on occasion treated younger patients for sweating.
Are these people who have got a real problem, or is this vanity gone nuts?
Hyperhidrosis is a real medical problem. So sweating is a normal bodily function. Anyone, if you put them on a treadmill, put them in a sauna, they will sweat, and that's normal. But to be wearing a fresh cotton shirt, getting up to speak or meet a new person, all of a sudden being wet on both sides to the waist, or having wet hands to the point of dripping, that gets annoying.
Yeah, so this is actually a medical condition that I was unaware of until speaking to you right now.
According to which studies you read, they quote up to 10%. So it's actually maybe a lot of people in the society silently managing this condition.
Yeah, so I imagine if you do suffer from it, what's the actual what's the specific name for it?
So hyperhidrosis, meaning increased sweating, excessive sweating to the point of affecting social function.
Yeah, so that would, I can imagine that boys or girls would become a little bit, what's the word, they'd be very aware and lacking confidence if that was happening to them.
Typically, someone who comes in has been managing this on their own for a number of years. So in a teenager, it might start sometime in their mid-teens, and then periods of higher stress, such as exam time or coming into summer when they're wearing flimsy clothes or formal, as you mentioned.
Okay,
that's when they start doing a lot of Googling.
Speaking I'm finding off Dr. Webb. Dr. Grace Lin is with me, for a cosmetic physician. What about young people, teenagers in general? If they don't have that condition, how do you feel about injecting them with Botox? If
they don't have a condition, they typically don't want to lie down and be jabbed with a needle multiple times. So initially, you do a sweat test to ascertain to yourself that the patient does have the condition. But then you think to yourself, why would these young girls, they don't even like to get an immunization needle. So for them to lie down and be jabbed multiple times, they really truly have the problem.
Do they have to get parental permission up to a certain age?
Absolutely, it's a requirement. So it's a medical condition and it's a medical treatment. So we always require them, and quite a lot of the times they're brought in by parents anyway, but when they present by themselves, they're asked to bring in one of the guardians, and it's only ever done with the full consent of both parties, and with a parent present as well. That's how I hold their head.
In many areas of business, there are people who are doing some of this work, doing work that we might call a backyarder. Are there unscrupulous people perhaps injecting youngsters with Botox?
I suppose, like every other business.
It could happen.
It could happen, yes.
But parents would soon become aware of what's going on, wouldn't they?
Oh, you'd hope so.
Yeah.
But most of the time, I think the perception is that maybe these are vain girls, but quite often they're high-achieving, highly intelligent, well-spoken girls. Any parent will be proud of. So I think yes. So the type of people who come in actually are treated as they're very detached about it. They're treated as a problem, a set problem with a proven safe solution. So I wouldn't expect my little girl one day to turn down something like this, an easy fix, just so they can prove they're self-assured.
Dr. Grace Lin, you've changed the way I was thinking about this very topic, and thank you for coming on the program.
Thank you very much. It's a pleasure.
It's 28 to 3. News headlines. The Jeff Shaw's story, Heidi Murphy, has changed pretty dramatically.
Certainly has, Dennis. Security